Discovery of the gonococcus in chronic urethritis. May I get married? The frequency with which the sufferer from gonorrhea presents himself with this question on his lips is a sad commentary upon the levity of youth. Yet it is a question which the practitioner is frequently, nay, commonly, called upon to answer. And upon the correctness of that answer, the happiness of a household often depends. An error on the side of overcaution, forbidding a man to marry when he has a perfect right to do so, is only less heinous from the patient's point of view than the permission to marry before the danger of infection has passed. On the one hand, there is the prospect of moral despair for both parties. On the other, the certainty of infection of the innocent, with all its train of physical woes, and the possible discovery of the guilty partner, with results that need not be dwelt upon. And unhappily, the question is not an easy one to answer. So difficult is it, indeed, that scarcely any two authorities agree as to the criteria upon which the answer shall be based. Against the genial vagueness of the light-hearted practitioner, himself a roué, who proclaims that one is free from danger as soon as he is down to his customary morning drop, we may oppose the Spartan severity of those few authorities who assert that once a gonorrheic, always a gonorrheic, once infected, always infectious. The broad-minded advisor will avoid either extreme. He knows full well that the majority of men who have had gonorrhea become and remain absolutely sound and clean. He recognizes also that while most of those who exhibit the traditional morning drop are undoubtedly infectious, there remains an important minority even of these that cannot impart its disease under whatever stress of sexual excitement. These are practical, commonplace facts. We need not concern ourselves with those rare cases of alleged marital infection 10 or 20 years after a cured gonorrhea. By their very nature, such cases are open to a suspicion of that symptom common to all venereal disease, viz. Lying, and against them I can advance the experience of 35 years, during which countless patients have been advised to marry by my father and his associates with but a single error, so far as I know, and all will recognize the probability that such an error would rebound forcibly enough upon its perpetrator. Such being the case, I am willing to assert the possibility of determining the presence of gonococci in any given urethra. Footnote: while the diagnosis may thus always be definite, the prognosis must remain indefinite. I can tell a man that he is or is not now infectious, but if he is now infectious, I cannot tell with any certainty when he will become clean. That is a matter of relative immunity, severity of lesion, faithfulness to treatment, details differing for every case. When does the gonorrheic patient cease to be in danger of infecting the woman with whom he cohabits? Not until the gonococci have been entirely eliminated from him. The gonococcus is the sole infectious agent. If it is present, there is danger. If not, there is none. But to find the gonococcus is no easy matter. Its presence may be suspected on account of the symptoms the patient presents, and this clinical evidence was all we had to go by until within a few years. Or it may be proved by the evidence which bacteriology has at last provided.